guys, it's Dr. Manson back with another Body Signals workshop. Today we're going to be talking about how to bulletproof your low back. Before I get started with the seminar, I want to tell you a little bit about myself. My name is Dr. Brandon Manson. I am owner of KB Chiropractic in Hudson, New York, and Hudson Disc Center, where I specialize in herniated and bulging discs. I've been doing this for 19 years, 15 years in Hudson as of this month. Congratulations to me and my staff and everybody that's been with me for that amount of time. I would like to take a moment just to recognize everybody that has been with me for this period of time. I really appreciate you choosing our office, and I do the best I can to help you. This workshop is a perfect example of what you can do and stuff you can do to help yourself. So moving forward, let's get started with this workshop. All right, patient presentations with low back pain, tight muscles, decreased range of motion, stiffness, leg pain, swelling, burning, numbness. How do these symptoms present for everybody? Not quite the same, but similar to this. This is a best case scenario. Let's talk about how it would present with different people. So a contractor or a construction worker, heavy lifting on their feet for long periods of time, boom, there you go, tight back muscles, low back pain, stiffness, shooting pain into the leg. A busy mom, gathering all the people's stuff that they need to go and do their sports activities, getting the kids to school, rushing off to work and to do all this. Busy athlete, high impact, running, physical stresses, an executive or office worker sitting at your desk in front of the computer or any type of social media device you have to do for that type of stuff. I can tell you, here's what I know. Back pain is incredibly widespread. Everybody has it. So many people have it. It derails life, fun, fitness, productivity, sleep, energy, and life. It almost totally is preventable and absolutely correctable. So let's get started with doing this. But to correct the problem, you must understand what the cause is. So let's take a closer look at what the back problems are. This is what a common low back looks like. As you can see here, there's bones, intervertebral discs. There's an opening in between there called the foramina, and the spinal cord would be there and the spinal nerve roots would come out. There's a number of things that are surrounding here, muscles, tendons, ligaments. They attach to the spine and allow it to move, as well as nerves that are housed inside there and blood vessels and so on. It functions as a protection unit for our nervous system, and that will stop us from being in pain in theory. When that doesn't work, it can cause some other problems. Here's what a disc herniation looks like. The inner portion of the disc there is called nucleus pulposus. Surrounding it is what we call the annulus fibrosus. What you can get is you can get a fissure or a tear, as demonstrated here in the image, in which that inner nucleus pulposus can start to leak through the annulus fibrosus. Now the center portion of that disc is a jelly type of liquid type of substance, and it can leak out and put pressure on the spinal nerve and or the spinal cord, causing an irritation. This demonstrates a motor unit, if you look here on the picture on the right, and it's two consecutive vertebrae with all the soft tissue, nerves, and all that stuff around there. It consists of the disc, spinal cord, foramina, nerve roots, etc. When we damage the tissue, inflammation can occur. Nerve irritation then can occur, which can create pain, numbness, tingling, loss of strength, decreased sensation, a lot of really nasty things. One of the most common forms of radiculopathy or nerve irritation is called sciatica. Sciatica is an irritation of the sciatic nerve. Now, if you look down at your pinky, your sciatic nerve is about the size of your little pinky specifically. If any compression or irritation in and around there occurs, it can create pain running down the back of the leg, lack of sensation, numbness, tingling, anywheres below there. Okay, so that can occur either in the lower lumbar spine or in the pelvic area or sacral area. That is what we call sciatica or radiculopathy of the sciatic nerve. It is not a leg problem, it is a back problem. It's a problem with the spine, a disc, or a nerve problem. This is what an x-ray of the low back looks like. If you look at the first picture on your left there, this is what we would call textbook normal. You see how that line runs down the back and everything kind of lines up? And then there's the openings behind there. Those are that foramina where the nerve root would exit. Now if you look at the next image, you can see that we superimpose the curve onto this from the other one. And you can see that the backs of these vertebrae do not line up. Specifically, you see where it juts out, it's circled in there. Okay, that can be a problem. Now, if we look at the following image to the right, the furthest one to the right, this is an MRI, and this is showing a herniated or bulging disc. Some people will call it a slip disc, and you can see how it's coming back into that into the spinal canal there, and it is causing a narrowing. That narrowing is called stenosis. Stenosis means narrowing of. It can be named for one of two areas primarily. We're talking spinal stenosis, in which it narrows the spinal canal as demonstrated here, or two, if that disc were to bulge into that foramina. If you look at the first image here on the left, you see those openings. If the disc bulges into that area, it can pinch the nerve. That would be called foraminal stenosis. So how does it show up in our office? With, like I said before, back pain, tight muscles, decreased range of motion, stiffness, leg pain, swelling, burning, numbness, tingling, people come in walking with two canes, crutches, walkers. It's actually quite terrible. The life effect is serious. It affects people in many, many different ways. Back pain presents in our office from simple aches and pains to totally disabling, and where people can't function. The reality is back pain tends to get worse over time. So a kid with back pain will tend to be an adult with back pain. As we age, our healing process slows, so it is very, very important to seek care sooner than later. There are a number of options that people try. As you look here, heat, bed rest, drugs, physical therapy, steroid injections, pain management, surgery, any alternatives. Chiropractic is on there, acupuncture, multiple things. So the question that we have to ask ourselves is, what are we trying to accomplish with our treatments, okay? Are we just trying to get rid of the symptoms, so we're just relieving the symptoms without actually correcting the problem? What is the goal? Is the goal to reduce the pain, or is it to correct the problem? What is a successful outcome? Okay, if we're trying to reduce the pain and we do this, it is successful. So if you take a Tylenol, it reduces your pain, that's successful. It didn't keep the pain away for a long period of time because it's not designed to do that. That does not mean it didn't work. That was a successful application of the Tylenol. Okay, so what we have to ask ourselves is, what are we trying to accomplish? If we know what the outcome is supposed to be, then we can determine whether this is the best care for our specific condition. Okay, we need to ask better questions. We need to be sure that it's safe and works very, very well. What's the difference in short-term versus long-term outcomes? A lot of different therapies will give you short and or long. It just depends what you're looking for. You have to know. So the proper treatment has to be for the proper problem. If they don't match up, you're not going to get the results you're looking for. So how bad is it? Okay, here's some stats on people with low backs issues. 80% of Americans will experience back pain. 30% have low back pain at any given time. Incidence is up from 29% to 34% since 1997. It's more common in females and affects a third of the females. 31% of men report that it affects their work. Only 20% of females report the same thing. They're clearly tougher, as every woman knows. 54% of low back pain sufferers are desk workers, which is something that's not so great. Sitting is also commonly called the new smoking. 50% of women experience back pain when they're pregnant. So what's the cost, direct and indirect? $50 billion in direct cost and $100 billion in indirect cost. That's just a ridiculous number. The life effect, the real story is how it affects our lives, how it affects all these people that have this pain, with missing work, losing money, productivity and jobs, with missing play, having to stop doing the things they love, stop exercising, active lifestyle. This creates a downward spiral, and living around the problem is not the way to do this. You don't want to stop doing the things you love. You want to continue to do those. But then it can get much worse than that. New or severe pain and suffering equals acute pain. Then we get chronic issues. They begin after the first bout isn't resolved, which then leads to drug use. First popping over-the-counter drugs, Advil, Tylenol, Aleve, then prescription pain pills, and then you get into illegal street drugs. This sounds so nonchalant the way that I'm saying this, but this is literally how it happens. I've seen this happen many times over the years, and it's really, really sad. This is our nation's biggest health issue, believe it or not. And now you do know this, okay? I've seen this firsthand, and it literally destroys lives. It destroys families. This is not how you want your pain or your family to deal with it. This is a little bit about DEA-approved drug production. Look at the increases in illegal narcotic production from 93 to 2016. These are very, very powerful, highly addictive, prescription-only, hardcore pain pills. And the doctors know this, yet they still continue to prescribe them. You know them as oxycodone, morphine, fentanyl, hydrocodone. Pain needs an arc, okay? The number one selling drug in America, drug class in America, are these, okay? We want to really not do these. They have overtaken the statin drugs and anti-anxiety medications, which were the big thing back, 10, 15, 20 years ago. So how do we prevent this? How do we prevent this from getting worse? Here's a map that shows sort of where we fall compared to other states in the country, and you can see opioid prescription per 100 people. New York is actually one of the better ones. As you can see, there's not too many green ones, but that's 52 to 63 people out of 100 are on these medications. That's a ridiculous amount, okay? We really don't want to treat it this way. This is not the best way. So if we look here, 40 people a day die from narcotic prescription overdose. Enough painkillers prescribed in 2010 to medicate every American adult around the clock for a month. Think about that. 24 hours a day for 30 days straight, every American. That's unreal. That's unbelievable. That's not even practical. It's unethical. This shows the overdose deaths involving opioids, cocaine, heroin from 1999 to 2010, and it is pretty significant. You can see the jump here. It's disgusting. So who's seen this in the media? I'm sure everybody's seen something to go ahead and have some reference point to what I'm talking about. This is widely considered the biggest threat to our country, and it's something we don't need to deal with. So put your hand up if you, and I know I can't see you, but I ask you to do this just to do this, if you think we have a health crisis. I certainly do. The number one reason we now have is a drug culture instead of a health care culture. We need to focus on health, not on the drugs. People are taught that drugs are the first and best choice for managing our pain and our health. For every problem, there's a pill. For every pain, there's a drug. Who agrees with me? Who knows that this does not end well? I certainly do. Who thinks that we need a better way? I think if you guys have heard me speak before, you know that we need a better way. Again, here we go. Heat and bed rest. These are some options that people can do. Drugs, physical therapy, steroid injections, pain management, surgery, chiropractic, acupuncture. There's a lot of different things, okay? If your premise is wrong, then your approach is wrong, okay? Heat, if you put heat on, that creates inflammation. You have an area that's already irritated and inflamed. Adding heat is going to cause more inflammation. More inflammation creates pressure. Pressure in the body equals pain. So more pressure in that area, boom, more pain. Okay? Bed rest. Bed rest was a common prescription for people with low back pain for years. And what they found is people don't do well with that. You're better off moving. It helps to get imbibition into the joint, which is nutrients in and out of the joint there, and this also can lead to muscle atrophy if you're laying in bed for long periods of time. Drugs cover up symptoms, which reduces the body signals that we see. Okay, the body signal is our body's way of sounding an alarm. Stop, I'm in pain, stop, this hurts, don't do this. Okay, unfortunately it's the last sign that is the pain, and people don't understand that the problem has actually been going on for a period of time for most. PT can be excellent choice for treating soft tissue injuries surrounding a problem, but it must address the problem. Like I said before, the proper treatment has to be for the proper problem. If they don't match up, you are not going to get the results that you're looking for. Okay? Steroids are a great anti-inflammatory, but they are dangerous and powerful, and they can cause long-term joint damage, especially if used frequently. Okay, pain management is not really addressing the cause; it's just trying to reduce the symptoms, mask it, and that's not really what we want to do. Surgery, as you see here, surgery is also it's a very, very dangerous thing. I always say there are 3 outcomes from surgery. Option 1, you get better. Option 2, you don't get better and you still have to go through all the therapy, the healing, all that process. And 3, there's no change. Okay, so think about that when you consider surgery. You have those 3 options. You're going to have one of them, I guarantee it. Which one are you going to have? Everybody wants to feel better. So here's what happens. This is a couple of nasty, nasty pictures. You can see the one in the top left. This is them inserting some surgical material. The one right below there shows the incision for some people. Is that large? That's actually a really, really large one. If you look up to the top right, you can see where the screws go into the spine. They actually do this. And they put the rods in connecting the two, which restricts the motion. If you look below there, that's what it looks like on an x-ray, okay? This can be really, really bad. Can also help with people's pain to some extent too. Again, the proper treatment has to be for the proper problem, okay? Some people do get success with that. A lot of people don't get success with this, okay? So we need to think safety. Is this going to give me the results that I want? Okay, is this the #1 best option for you, or is the absolute last resort option? Okay, there's got to be a better way. That's how I look at this. There's got to be a better way. So what you need to do is you need to ask better questions. What are the risks of this procedure? What are the costs involved? And the costs, sometimes it's covered by insurance, but then you have missed work. You have follow-up visits to the doctor's office, rehab, pain medication. All this stuff is something that is not put into that. So you have to process this on your own sometimes. What are the expected outcomes? Are you going to be better? Are you going to be about the same? It's different for everybody. Can I interview 10 of your patients? That's a question that most doctors will probably say no to, but it's one you certainly could ask. What does the research say about this? What is the follow-up period? afterwards with some of the studies that you get, okay? What are my options if I choose not to do surgery? Is this treating my symptoms or correcting the cause of my problem? These are all great questions that you would want to ask the doctor, especially before they go into doing any type of permanent procedure such as surgery, okay? Once you do surgery, there's no going back. This here shows how pain sufferers rated their treatments. Prescription medications, 58% said they did well. 54% say chiropractic treatment was great. 48% say physical therapy was great. All of these definitely have some validity with dealing with back pain. What is the goal of that treatment? Is a prescription medication fixing the problem, or is it managing the pain? Is chiropractic fixing the problem or managing pain? Is physical therapy fixing the problem or managing pain? You need to ask yourself this. How about the cost effectiveness? What's the best way? What about adverse outcomes? What are the risks? How about the addiction issues? You need to ask all these questions when you are determining the type of care that you want. Okay? Low back pain, tight muscles, decreased range of motion, stiffness, leg pain, swelling, burning, numbness, tingling. These are all of those symptoms that I'm talking about, okay? The symptoms are warning signs from your body. This is what we call body signals. They are communications from your body begging for mercy, begging for you to stop doing something that is hurting you, or start doing something that is good for you that you have not been doing. Sometimes the body whispers and sometimes it screams, and sometimes it just kicks you in the butt. Has anyone in here ever had that for a moment? 1 second of you're fine, and then you decide to pick a pencil off of the floor, and boom, your back goes out. You can't pick it up off the ground. You can't move. You can't stand up straight. You have radiating pain going down the leg, stiff muscles in that low back. You can't do anything, okay? Next, you're looking at the ceiling, and you're holding the low back because you can't even move now, okay? This is a life effect. So what happens in the next few days? You stay there on bed rest and heat it, so we cause extra inflammation. We decrease the imbibition in the joint, which are the nutrients coming in and out. Let the muscles maybe atrophy a little bit, or do you want to do something that is effective in helping to treat your problem? We'll get there. So what are body signals? Body signals are symptoms. If you look here at the tip of the iceberg, that's just the smallest thing. That little symptom leads to a much bigger picture, as you can see here. The way you think about symptoms drives the choices you make, which in turn drives the outcomes that you get from your care. Okay? That's why I have this body signals series set up for you. Let's talk about the symptoms. Okay? This is a wellness continuum. Okay? And you can see, if you look at the left, sickness, death. As we move towards the right, you start to see high-level wellness and health, okay? Which way are you going on this? Are you going towards the disability, going to awareness, education, growth, high levels of wellness? On the health continuum, where do you fall? What direction are you headed? At what velocity towards or away from health are you going? Mass times velocity equals momentum. That's not something we want to have going in the wrong direction, do we? Okay? You need to understand your symptoms. You need to understand your body signals, your body's alarms. You need to learn how to speak body. Okay? This is your innate intelligence. Learn how to interpret the body signals. Make better decisions, which leads to better choices, which leads to better behaviors. So what is your objective for care? Is it temporary relief of symptoms, or is it to regain your health and function? The way you think is your belief system. This organizes our behaviors. This is our choices, okay? Which then leads to outcomes, which are the results that we're looking for, or results that we don't want. This takes us back to our 3 causes of the healthcare crisis. Number two, people are taught that symptoms are the best indicator of health. Now, do we really believe that after everything I've just said? Less than 10% of your nerves are for pain. The other 90% control other things. Tightness, fatigue, spasms, weakness, sinus allergies, energy, digestive problems, breathing problems. I bet you this is something you didn't know. In fact, much less than we realize, we rely on our nerves for pain, okay? The rest is really all for function. Did you know that there are 9 families, wow, of function of the nerves, okay? They have many jobs, not just pain. Functions like motor, reflex, trophic changes, breathing, metabolism, reproduction. Remember, your nervous system is the master communication system of your body. It's the fuse box. Okay? It's the master communication system of the body. The skull is the helmet that protects your brain. The spinal column is a suit of armor that protects your spinal cord. If it stays healthy, communication is optimal. Health is now optimal. Your body talks to your brain. It tells it what it needs. It tells it how to adapt. Your brain listens and responds. This tells the body what to do. This is how you stay healthy. This is how you function. This is how you heal. What happens when communication breaks down? In a company, a factory, a family, communication is everything. Your nervous system is the communication network of your body. If you want a healthy body, then you need a healthy nervous system. If you want a healthy nervous system, you need a healthy spine. Imagine what happens to these very delicate nerve fibers when there is swelling from tissue damage in these spinal joints. Yes, very often there is acute pain. Your smart body telling you to stop doing what you're doing, but you don't listen to it because you're not paying attention to the symptoms. Do you think that only the pain fibers are irritated, or do you think that the other 90% of the nerve is irritated as well? So do you think that you're going to have spasms, weakness, tightness, fatigue, maybe low energy, digestive problems? Maybe. Maybe. Do you know what is far scarcer? Most nerve impulses or signals head back to the brain. Okay? If they're not going back to the brain and going back to that end organ, you're going to have a problem. And the change in brain function, well, which of course changes our physiology and our global health. We don't want to have a problem there, do we? Stress response. Stress response is very, very interesting how the body works. Okay, we have a couple different components here. We have autonomic nervous system, which is going to be our rest and repair, or parasympathetic. And then we have our sympathetic nervous system, which is our stress response, or our fight and flight. Stress triggers the stress response. Okay, the stress response is run by stress hormones primarily. Okay, which leads to adaptive physiology. It saves our lives in the short term, but shortens our lives in the long run. So our blood pressure increases with the threat of stress, real or perceived. Our heart rate increases with threat, stress. It's also real or perceived. Muscle tone increases with threat or stress, real or perceived again. It doesn't matter. Okay. Our digestion speeds up initially, but then slows down. Is that a good thing? Reproduction or sex drive gets downregulated. We have a decrease in our serotonin levels. We have an increase in sensory systems. Fear and anxiety increases with threat. Stress, real or perceived. Our immune response gets downregulated. Insulin sensitivity gets downregulated. This is all bad stuff, guys. Our blood sugar gets up. We have a decrease in our HDL, increase in our LDL. This sets us up for diabetes, heart disease, heart attack. Okay, this is bad stuff. Here's a premise I want you to get familiar with. Health is normal. Healthy is normal. Your body is smart. Your nervous system is the master system, and your spine is your suit of armor. Modern life is unnaturally stressful. We need a better premise, guys. This should be your premise. Everyone says stress. Who feels like just keeps moving faster and faster, gets more stressful? Put your hand up if you think that stress is worse today than it was 5 years ago. Who thinks that it will probably stay the same? I do. Or maybe even get worse. Hopefully it stays the same or gets better. That's the goal here, isn't it? So we believe there are 3 T's, okay, that affect stresses in the body, okay? They are thoughts, traumas, and toxins, okay? There's a couple different types of stresses that we also refer to in macro and micro, okay? Macro are big and micro are small. A macro trauma is a car accident or a sports injury, a slip or fall, falling down a flight of steps. These are obviously physical stressors. They can often cause pain and overt signs of damage, and they can be serious for sure. They can also cause something that may not be so obvious. They can cause you to have pain down the line. These here are smaller micro traumas, okay? We're out there raking the yard, we're shoveling snow. You don't have to go ahead and be in an accident and have a problem. It can be a small thing like this. It can be picking up a pencil or cleaning the windshield of your car. This is the majority of what people present in the office for too, by the way. It's not the big ones, it's the small ones, okay? Everybody, including our kids, suffers from micro traumas, okay? How many people feel like they're spending way too much time sitting in front of a TV screen, a computer screen, your cell phone? What about your family or kids? What do you think, they're sitting too much? I would say yes. I'm sure almost everybody is doing too much. I do too much as well. Sitting here recording this for hours on end, it seems like, and prepping for it takes a long time. So you have to find the balance, okay? How many think this problem is unhealthy? In many ways. I definitely do. Let's talk about one very serious way this is causing a problem for you and me and your family. Let's talk about the microtrauma. Sitting is the new smoking. I know I hit on this a little bit before. How many feel that you're spending way too much time sitting nowadays? Your kids. Experts agree with you. Most modern life is very, very sedentary. We spend way too much time sitting. Those same experts also tell us that we're spending the majority of our waking lives sitting, averaging 8 to 10 hours a day. Think about that, 8 to 10 hours a day. Now 7 days a week. That's unreal. This is directly related to an increase in obesity, diabetes, heart disease, and statistically a shorter, sicker life. And to make things much worse, we are spending most of our time sitting in front of a screen. If sitting is a new smoking, then screens are the new crack. This, my friends, is the leading cause of increased stress in our bodies in modern life. This is the most common microtrauma, the biggest source of stress that people are facing today. And the stress causes dangerous conditions in your spine called a subluxation. The subluxation, macro and micro traumas cause damage to your spine and connective tissue, your ligaments, muscles, and tendons, your spinal joints. More significant trauma creates nervous system stress and interferes with communications. This changes the information going to and from the body and the brain, interfering with healthy nerve function. This condition is known as a verbal subluxation. Everyone say subluxation. Subluxation. Here's what happens in a subluxation. We get joint misalignment, soft tissue damage, inflammation, nerve irritation, muscle spasm, loss of inhibition, joint fixation, and elevated stress hormones. Is this something we already talked about? You know we did. We definitely just talked about this. Here's the stress response again. Do you think this is related to any of this? Okay? Yes. Don't make me go over it again, okay? If you think that's scary, remember, less than 10% of your nerves actually feel pain, which means that the most commonly happening without pain are other obvious symptoms. The most common symptom of a subluxation, wait for this, is no symptom at all. So how do you know there's a problem? This is true for most common health issues, by the way. For example, what are the symptoms of heart disease, of diabetes, of cancer? Most people don't know. Even the most ubiquitous health problems like tooth decay. By the time you have symptoms with most dental issues, it's already too late. There's already a problem. Is this an early sign or a late sign that you have a problem? So why are we taught to judge our health and manage our health by symptoms if they're such a poor judge? Interesting question, right? How do you know if you have a subluxation? Well, number one answer is really simple, right there in yellow. Get checked. Get checked by your chiropractor. So how about you? Have you been checked? It's time to do it. Are you wondering about your spine and your nervous system? What about your families, your kids? By the time a kid is the age of 5 years old, they fall on average of about 1,000 times. You watch these kids go down, they go down so hard with the force literally of a small car accident. You think they can have a problem? Are they really growing pains that the kids are having? Or is it perhaps maybe an uncorrected subluxation? They don't know what's going on. You don't know what's going on necessarily. Maybe it's time to get them checked too. A lot of times you don't know. You don't see it. The kids don't tell you. Okay, so simple. This is your next steps if you want to go ahead and figure out if you have a subluxation, if you need it. Call the office. Very simply, pick up the phone, 518-828-3662. Call the office. Don't want to call the office and talk to us? Not a problem. Go ahead and go to our website, KB, K as in kid, B as in boy, Chiro, that's C-H-I-R-O, Hudson, HUDSON.com. Go on there and request a free consultation. It's that simple. Just go ahead and do that. Number 3 reason we have a health crisis is procrastination, guys. Not doing anything, waiting until there's a problem. That's the number 3 problem, okay? As always, I want to equip you so you get better results. And as usual, we'll look at the traffic light approach. There are things that you'll need to stop doing, okay? There are things that you'll need to slow down and reduce. There are things that you'll need to start doing. In order to correct the issues or end your back pain and prevent it from reoccurring again, is to do something, okay? Three-legged stool. You know the significance of a three-legged stool is they cannot be tipped over very easily. They're relatively secure even on an uneven surface. That's why it's so steady. That's why it's the number 1 stool that you want to get, okay? The three-legged stool is simple. Stop the bad habits, add specific core exercises, add specific chiropractic adjustments, okay? Adjust in rhythm, break the bad habits, and strengthen and exercise. That's the plan. If you guys want to call and get a free consultation, call the office, 518-828-3662. You can also go online to K as in kid, B as in boy, Chiro, C-H-I-R-O, Hudson, HUDSON.com, and go ahead and request a free consultation. That way we can check you out and see if there's anything we can do, stop or prevent. Okay. Thank you so much for listening to my webinar here. I appreciate your time and thank you again for everything in the 15 years. I can't tell you how much I appreciate it, and I love that I'm able to do this and possibly help you, your friends, your family. If you have anybody that may be interested in what you just watched or listened to, forward them the link. They can still register. This is going to be live for about a week, and listen to it over and over if you feel that you missed something. All right, guys. Thank you so much for your time. Have a wonderful, wonderful, wonderful rest of your day.